Can diabetes affect fertility? Does it matter if you have type 1 or type 2? Today on Nourish, we'll answer all of these questions and more. If you've got diabetes, this is a must-watch episode, so stay tuned. So I'm very excited to welcome Larissa with us today. Hey Larissa.
Hello, hi Mel, how are you going? I'm very excited to be here.
So thanks for joining us. Larissa, can you just tell our audience, first of all, just a little bit about what you do?
Yeah, so I'm a dietitian located in Geelong, Australia, and my experience is working in both clinical and hospital settings, and also more recently working in private practice. I'm also a qualified diabetes educator as well, and I guess I really have developed an interest quite early in my career in pregnancy nutrition. Particularly, I just find that it is quite a challenging time or life stage for women to really achieve a healthy diet and healthy eating, and it is also really important as well, as we know what we eat during pregnancy does really impact, you know, the outcomes for baby and mum as well.
Yeah, very, very important. And yeah, you're doing amazing things, specialising, like bringing those two together, that specialisation in diabetes as well as nutrition and diet. So in terms of fertility, so for people who already have type 2 diabetes or type 1 diabetes, does their diabetes impact upon their chances of conceiving at all?
Yeah. Both type 1 and type 2 diabetes can impact the chances for women wanting to conceive in slightly different ways. So for women who have type 1 diabetes, particularly if they've had that for quite a long period of time or large part of their life, it can interact with the hormonal regulation that stimulates a regular menstrual cycle.
Right.
Type 2 diabetes is a little bit different, so it is driven by something that we call insulin resistance. And type 2 diabetes, often, I guess, common risk factors for type 2 diabetes are obesity and polycystic ovarian syndrome, and both of these things on their own actually can impact fertility as well.
Yeah, okay. So in terms of optimising your fertility, if you have the type 1 or type 2, have you got some tips that you would recommend to women?
So I think for all women with type diabetes, whether it's type 1 or type 2, it is a really important time to engage with your diabetes team. So whether that's a dietitian, a diabetes educator, an endocrinologist, that support team that you have around you for your diabetes. We know that glycemic control at the time of conception is really important to reduce the risk of congenital abnormalities and also miscarriages and stillbirths and things like that too.
So can you explain a little bit about what congenital abnormalities actually means?
Yeah, so we know that the glycemic control at time of conception, if we're not quite getting as good blood sugar glucose control as we'd like to be achieving, it can interact with the DNA of the egg health and also sperm health at time of conception too. And this can lead to congenital abnormalities such as neural tube defects and things like that.
So really we want to be optimising diabetes levels prior to conceiving if possible.
That's correct.
Okay. And you mentioned in terms of men's health, so how does diabetes impact upon sperm health?
Yeah, so diabetes can actually impact fertility for men with diabetes as well, which is a really important thing to think about, both type 1 and type 2 diabetes. So a complication of long-term diabetes is erectile dysfunction, which can cause fertility issues. Also, we see in men with type 1 diabetes that they do sometimes have lower sperm volume and reduced sperm motility.
Right.
For men with type 2 diabetes, we see that the inflammation or chronic inflammation that's sometimes associated with type 2 diabetes can really drive DNA changes in sperm health as well.
And do you find that improving a man's diabetes levels, their glucose levels, that will improve those outcomes?
Absolutely. So a lot of these, I guess, issues that we talk about with fertility and men's fertility and sperm health and things, they do, I guess, depend on our blood sugar level control. So if we're able to work and engage with our diabetes and improve our blood sugar level control, it will reduce the risk of some of these things from occurring.
Fantastic. So is there any other tips that you'd like to provide to people out there who maybe have either type 1 or type 2 diabetes, who might be thinking about trying to have a baby in the next 12 months?
Yeah, absolutely. So seeing a dietitian with experience in fertility and also diabetes at this time is really important. So a dietitian is able to provide individualised, tailored plans around how food and what we're eating really impacts our blood sugar levels and what we can do to improve our chances of falling pregnant and having a normal, healthy pregnancy.
So some amazing tips from Larissa. So I guess what we're really hearing is that if you do have type 1 or type 2 diabetes, that it is a good idea to improve your glycemic control before conception. So I'd really encourage you, if you know somebody who does have diabetes, please share this video with them, because you never know who is trying to conceive and when they're trying to conceive. So it'll be really helpful for them to check this out prior to them getting pregnant. Also, if you do have any questions, feel free to type them in the chat box below. We're more than happy to answer your questions. And make sure that you do download my fertility meal plan. It's free of charge. Just go to www.melaniemcgrice.com/fertility. And then make sure that you enjoy some of our other videos by subscribing. So I look forward to seeing you in our next video. Oh, so we're going? We're live?